I'm Rinda Blom and I'm going to explain to you how to do a session of Gestalt play therapy in the sandbox. This would normally be part of the phase of emotional expression. And here is the sandbox in front of me, and I've asked the child to pick between 10 and 15 miniatures to build a story in the sandbox. So now I, as a therapist, will just sit very quietly while the child will finish the sand scene. So I'm going to put myself now in the role of the child and build the scene as if I am the child. So let's see what happens here today. Maybe I will put that house there, and there's a crown, and you would also take notice of what the child put in first and second and third, and where the child put it, as well as if the child takes stuff in and out and moves stuff around in the sandbox. There is a tree and the rainbow in front of the tree, a little bridge. So now it looks like this. And you can see, let me just move there. There we are. Let's see what else do we have here. We have golden coins. We have, maybe the child will put a snake there. Here we have 3 frogs. Maybe we will do it like this. There we go. Here is some nurturing there. Some fruit and veg. And maybe put an egg there. Caveman. Also look if the child moves the sand or makes specific patterns in the sand. So sometimes children will not put everything in the sand that they've picked. So here we still have a baby and a lady. So just let's make sure you can see from the top everything. So there we have 3 frogs, tadpole, a crown, a lady, looks like maybe a doctor or nurse. In that corner we have the tree with a bridge and the fruit and veg. Here we have a set of coins, or a pot with golden coins, and here, let's just move to the other side. We have a lady, a baby, and it looks like a caveman. Right, so now let's move to the steps that we will apply in Gestalt play therapy. So as a therapist, I would start off asking the child to tell me, how did you feel while you were building this? So for older child, you can ask, what was your experience? For a younger child, how did you feel? And you can help the child in terms of maybe you felt happy or sad or scared or angry or normal, or depending on the child's feeling language, the child will tell you a specific feeling. Maybe, let's say in this situation, the child said, I felt a little bit scared. The next question that you would ask the child is, what did you build here? Tell me more. Now, if we stay on the projective level, maybe the child will say something, just for sake of example, of, let's say this is a 12-year-old boy, just for a demonstration. And he would say, okay, so in this story, there is a house, and in front of the house there's a snake, and the snake is very hungry, and the snake Snake wants to eat the egg there. And here we have a little baby and a caveman that would be prepared to protect the baby. And we have a little girl that is standing there next to the caveman. And maybe he might say, here we have different frogs and a doctor and a golden crown. And here is a pot of gold. And there we have a tree and a rainbow and fruit and a bridge. So that would be your second step. First step, how did you feel? Second step, what do we have here? Third step is now, in terms of the Gestalt, to give each one of these a voice. So as a therapist, you will start off and you will maybe point to this and say to the child, I want you to say, I'm the house. So the child will say, for example, I'm the house. So you might also say to the child, if you can imagine that this house is a puppet and you can give it a voice, what would it say? And the child will say, I'm the house. And now maybe the child will tell you a little bit more about the house, or maybe the child will just say, I'm the house. So then as a therapist, you can say, hello house, tell me more about yourself. And maybe the child will say, I'm a house, I'm steady, I'm strong, I have a red door, there are two people living inside of me, and there's a snake in front of me, and this snake is very scary. So you can also child a little bit more questions if the child, especially younger children, will maybe just say, I'm the house. Now you would go to the next one and say, okay, so I want you to give the snake a voice and say, I'm the snake. So the child might say, I'm the snake. Hello, snake, tell me more about yourself. I'm a snake. I'm very angry. I'm just waiting for these people to come out of the house. Then I'm going to destroy them. I'm going to bite them. I'm going to put my poison in them. And I am also very hungry, and I'm just waiting for the opportunity to eat this egg. Next, you might say to the child, okay, let's give the egg a voice. I'm the egg. Maybe the child might say, for example, and I'm very scared because I'm in front of this house and there's no one that protects me, and this snake is going to eat me if no one comes and help. Next, we move over here. So maybe the child will say, if I ask a child, can you give this caveman a voice? I want you to say, I'm the caveman. Child might say, I'm the caveman. I'm here, I'm looking over the scene, and I'm here to protect the little girl, and I'm here to protect the baby. And maybe you as a therapist can also, do you think there's anything that wants to hurt the baby? And the caveman can say, maybe the snake can hurt the baby, but fortunately the snake is not seeing the baby. But if the snake turns this side, I will definitely kill it. And then you might ask, okay, let's give the little baby, a voice. I'm the baby. I'm 1 year old. Hello, baby, you as a therapist must say. So tell me more about yourself. Do you have parents? I don't have parents. My parent is dead. But I have this caveman that is really protecting me. And he is looking after me and makes me feel safe. Maybe, how do you feel about your mom and dad dying? Maybe the child will say, I'm sad about that, or I don't care anymore because the caveman is taking care of me. Okay, now we move. I'm just turning around so that you can see her, but you would not do that in a session. You would leave it exactly as it is. Hello, I'm the girl. Give the girl a voice. I'm the girl, I'm young, I'm finished with school. Hello girl, the therapist might say, what are you doing here? I'm just standing here watching over all of this, and I'm wondering what I can do to move to the bridge on the other side. I actually want to get to that food and that rainbow and the big tree. So I'm standing here and I'm wondering if it would be possible for me to go there. All right. Now